whenever you study any topic or whenever you write any answer to impress the examiner, you must follow certain footsteps. Okay, so you have to impress the examiner, right? So you have to follow certain footsteps because examiner will not have time to go through every details that you have written. So how to impress an examiner? So you have to write a content. Content means under which you're going to write the answer, or under the headings based on which you're going to teach a topic. So our topic for today is cell injury. So these are the contents. There will be an introduction part. There will be the causes of cell injury. What are the various morphological alterations that takes place? The mechanisms of cell injury. And finally, we're going to end with a few examples. Okay, so that's how we are going to deal with cell injury. Settle down, settle down. So when we talk about cell injury, the introduction is basically a little on pathology. Put your leg down. The introduction will be a little on pathology. So if I ask you, if I show you these two pictures, one lady on the left hand side and one lady on the right hand side. So based on this picture, you tell me which lady are you going to study today? Out of these two ladies, which one are you going to study today? On the right hand side. Why? Can you differentiate between these two ladies? So left hand side, which subject she belongs to? If she belongs to the right hand side lady belongs to our topic. I mean, not our topic, our subject, the subject that we are studying today, which is pathology. The lady to the left hand side, where does she belong to? Why do you think this lady, we are going to study about this lady today? What makes you think that we're going, I'm asking you one question. You said we are going to study about the lady on the right hand side. Why? What makes you think so? Pathology is the study of suffering. Very good. So she is suffering, right? Clinically, you can make out she is in pain. Whereas on the other hand, the lady on the left hand side, she looks absolutely fine. She looks jovial. She's smiling. So which subject she belongs to? Physiology. Because you have studied physiology, if you do not study physiology, you will never, and if you do not study anatomy, especially, you will not be able to study pathology. If you do not know what physiology is, if you do not know what normal is, the mechanism, the physiology, which will help you to study the etiopathogenesis, and if you do not know histology, especially in anatomy, which part of anatomy? I'm not talking about embryology or osteology, but histology. So if you do not know histology, if you do not know how hepatocytes look like, or if you do not know the normal histology of liver, you will never be able to appreciate what happens in a fatty liver, what happens in case of a cirrhosis of liver, what morphological alterations take place. That is the importance of studying. That is the importance of knowing first year subjects, especially anatomy and physiology. Okay. Pathology is basically the backbone of medicine. I do not say this. William Osler had said this. I don't say this. William Osler said this. As is your pathology, so is your practice. Because if you do not know the etiopathogenesis of a disease, you will never be able to diagnose any disease. Am I audible? Yes. You will never be able to diagnose a disease. In that case, as a physician, you will be a massacre, you will be a failure. So as is your pathology, so is your practice. If you want a good practice, you should have a sound knowledge on your subject, and this sound knowledge is going to come, it depends on how strong your pathology is. So as is your pathology, so is your practice. William Osler had said this. So having given you a brief introduction on pathology, now coming to the main part. So what is pathology? Pathology is basically the study of diseases. Patho means diseases. Logos means study. So pathology is basically the study of diseases. So what we do here? Pathology is basically what? Study of diseases. So what changes takes place in pathology? It's basically the changes in cells and tissues that happens during a diseases. the morphological, the biochemical, the structural changes that takes place in cells and tissues during a disease. For example, you know a normal liver, the histology of a liver. Consider a histology of liver. You know how the hepatocytes look like. Then you know the central veins, the hepatic artery, the portal triad. You know the size of a liver. You have better knowledge than me because you're fresh from anatomy. And you know the weight of a liver. That is a normal liver, which you have studied in anatomy. Now let's consider a fatty liver. What happens in a fatty liver? What morphological changes takes place in a fatty liver? Fat accumulation, a person drinking too much can acquire a fatty liver. So there will be accumulation of fat, which will cause increase in the size of the organ. Hepatomegaly, very good. So that is the morphological alteration that takes place, or the structural alterations that take place. And if the person keeps on, do not stop drinking, if he doesn't cut down on his alcohol consumption, this fatty liver can progress to what? Cirrhosis. So initially, the liver will be big. Ultimately, what will happen in case of a cirrhosis? The liver will shrink. It will become smaller. So that is the morphological alteration. So biochemical, structural and morphological alterations that takes place in an organ during a disease. So pathology basically explains the whys and whereofs of the clinical signs and symptoms manifested by the patient. See, pathology is in second year. When you go in practice, the patient will never come and tell you that I have this particular disease. I have this particular disease. For example, a patient presents with, So a patient presents with cough, fever, weight loss, right? These are the clinical manifestation. You can see it, right? These are the clinical manifestations. You do a physical examination and there is a sputum, cough with sputum. You do a physical examination of the patient and you see one enlarged cervical lymph node. You see a patient presents to you with cough, sputum production, fever, weight loss, evening rise of temperature. Okay, you guessed what it is. Tuberculosis, you have guessed it. But you need to, theoretically you are correct, but you need ancillary tests to confirm your diagnosis. You do a physical examination and you see an enlarged cervical lymph node. So what do you order? In this case, what do you order? In this case, what do you order? Say you order an investigation, you write complete blood count. You do a CBC, a complete blood count, which will include a ESR. ESR will be raised in tuberculosis. I hope that the ESR will be raised in tuberculosis. Then you give a sputum for AFB. What is AFB? Acid fast bacilli. Acid fast bacilli. So they will do a, have you heard of it? They will do a ZN stain, a Ziehl-Neelsen stain. Then for this enlarged lymph node, you order a FNAC of cervical lymph node. Now fever can be due to many causes. Fever can be due to many causes. Weight loss can be due to many causes. A cough can be due to many causes. But slowly but steadily, you're moving towards a diagnosis of tuberculosis. So remember, a patient will never come and ask you, say, I have tuberculosis. Or give me this test. Give me a CBC, give me a ESR, give me a sputum examination, order a sputum examination for me, do a cervical lymph node FNAC. No, patient will never do that. The patient will come and present you with clinical manifestations. I have cough, fever, I have this, that. You as a physician, with tons of knowledge into your account, you have to come to a diagnosis. So theoretically, you have come to a diagnosis of tuberculosis. Now your theory must be backed up by your practical knowledge. So you order a few ancillary tests. You order a few ancillary tests. So what are these ancillary tests? The CBC, ESR, these are all the laboratory tests that you have ordered. This is exactly what is meant by this particular sentence. It explains the reason behind the signs and symptoms manifested by the patients using various techniques. Various immunological techniques, microbiologic techniques, biochemical techniques, pathologic techniques, hematological techniques, whatever the techniques are. These techniques helps you to finally explain the reason behind the signs and symptoms manifested by the patient. You got this sentence. Patient will present with clinical manifestations. With the clinical manifestations, as a physician, you will come to a diagnosis, you'll have a provisional diagnosis. Now to make your diagnosis correct, or in order to confirm your diagnosis, you order many ancillary tests. A few, not many, a few ancillary tests. And these are the tests you order. So basically, this is a final year subject. Entire thing is for example, this thing belongs to final year, right? You'll see in clinics. These are in clinics. And these are all the investigations that you get in, say, second year. This belongs to what? Lab medicine. So this is clinical medicine on one hand, and lab medicine is on the other hand. So basically, not only pathology, but pathology, biochemistry, and microbiology, they come under one umbrella. That is called lab medicine. Right? You got this? Is it clear? Is it clear? You'll be studying more in clinics about all these things. So basically, not only pathology, but also all this microbiology and biochemistry, all the subjects that comes under the rubric of lab medicine, they form a, what do they form? What is this? What is this? They form a bridge between the second year and final year subjects. Between the, I shouldn't use the word second year or final year, between the signs and symptoms manifested by the patient and the lab investigations. So this is the importance of lab medicine. So they form a bridge. Is this line clear? Is this concept clear? Now tell me yes or no. Otherwise, I'm going to explain again if it's not clear. Pathology, or the second, or the lab medicine, basically acts as a bridge between the final year, the clinical manifestations, and the signs and symptoms manifested by the patient. Clear? Should I explain again, or you need another explanation? Let me know. Okay, to the next slide without knowing. So pathology can be divided now into generalized pathology and general pathology, not generalized, that is general pathology and systemic pathology. You will come to know this is so basically what we are studying now is general pathology. Okay. So now coming to the core of pathology. Core of pathology, I like to explain things based on diagrams rather than on theory. So if you're studying, if you're interested in my classes, or if you follow my classes keenly, you'll see I'll be explaining more on diagrams rather than like putting too much of theory. Okay. So what you have to do is, what I teach now, you have to go back and start reading it. Otherwise, you'll not get a concept, because I'll be teaching more, I'll be writing something, but I'll be explaining more on, based on diagrams. So core of pathology, pathology is formed of 4 things. You must remember. One is etiology. Etiology, the causes of a disease. The causes of a disease. What can cause a disease? That is one thing. Number 2, what can this be? This is the pathogenesis. This is the pathogenesis. Number 3, what are this? Morphologic changes that takes place in the cells and tissues. Morphologic changes that takes place in cells and tissues, reversible and irreversible. I'll come to that later. And final one is the outcome. The outcome. How the patient manifests. There has been, you have been infected with, somebody has been, not you, somebody has been infected with a coronavirus. Okay. So that is the etiologic agent. Right, that is the etiologic agent. Number 2 will be how the coronavirus replicates inside the body. That will be the pathogenesis. Number 3 will be morphologic changes. What happens in the, how the patients manifested during corona. Most of the corona patients, what killed the patients? Respiratory problems. So basically lungs were affected. What morphological changes took place in the lung of that patient? And finally, the manifestations. Breathing problems. Right? So patient will come to you in a reverse manner. The sequence will be reversed when you see a patient. Here I have explained you, okay, coronavirus has entered, it has replicated inside the body, certain morphological changes have taken place in the lung, and that's why the patient presented with respiratory problems, breathlessness. But patient here will present to you, just like I have explained in the previous paragraph, previous slide, patient will never present to you, come and say that I have coronavirus, though patient may know. Okay, this is an example. So patient will come to you with breathing problems. Patient will come to you with what? Breathing problems. And you have to, based on the theory knowledge that you have to realize, or you have to come to a diagnosis that this patient is suffering from some respiratory problem. It can be a SARI, okay, severe acute respiratory illness, or it's a corona, whatever it may be. Then you have to think in terms of the etiology, pathogenesis, and morphologic changes. And to come to that, you have to order certain tests. This is the role of lab medicine. This is where lab medicine comes into play. How many of you, actually you guys have not seen corona because we were there. No patients were allowed in a corona ward without a proper positive corona result, corona report. Now who will do that? Department of Microbiology. That is also lab medicine. Right? No patients were allowed in a corona ward without a proper valid positive corona result. Who did that? Microbiology. Here, even though I'm teaching pathology, but microbiology is also a part of lab medicine. So I'm explaining a little on microbiology also. Who did that? Microbiology. Means lab medicine. Clinical manifestation versus lab medicine. So this is the bridge basically. This is the importance of doing a lab medicine. Your theory knowledge must be backed up by your practical tests. Clear? That is the importance of studying lab medicine. So core of pathology is formed of 4 things. Etiology, what is the cause? So what can be the cause? If you look back into history, when people did not know about the causes of the diseases, people used to say it is because the deceased person has done some kind of a sin or has done some kind of a crime. That's why God has convicted him with all these problems. But no, that is not the reason. Now we know there are 2 causes. Basic 2 causes. One is genetic cause and the other one is acquired. So what can be the acquired cause? Any kind of infection, whatever the causes may be. So I'm not getting into the details of that. Genetic causes, this you must be knowing at least in physiology and all you have studied. Genetic causes and acquired causes. Genetic is inborn, acquired is not inborn. That's why it's called acquired cause. Okay, first one is that, causes, etiology. Next one is Mechanism of development, pathogenesis. Pathogenesis. And to know pathogenesis, you must, right now, the human genome has been mapped. We know many genes which are responsible for various diseases. For example, I took the example for, say, cystic fibrosis. In cystic fibrosis, we know the mutant gene which causes cystic fibrosis, but that is not enough. You must also know the biochemical and the morphological alterations that takes place. What causes the cysts in the lungs and pancreas and various other organs. So knowing just one cause is not enough. You must also know, one thing is not enough. You must also know the other things. For example, even if you know the mutant gene, that is not enough. You must also know the various morphological alterations, the biochemical changes that takes place in the lungs or in the pancreas or various other organs which are affected by cystic fibrosis, which results in the formation of cysts. That is one example. Just like that, just like tuberculosis, knowing Mycobacterium tuberculosis is not enough. Knowing HIV is not enough. But you have to know what exactly happens, how the HIV virus replicates, that basically takes your immunity down. How does a Mycobacterium tuberculosis, M. tuberculosis react in your body, which finally paves the path for the various clinical manifestations? How Gons complex happens, how Gons focus happens, how there is a cervical lymphadenopathy, how spines can be affected, which we call a spot spine. So that is basically the pathogenesis. Number 3 are the morphological changes. Biochemical and structural alterations in the cells induced by the disease. Biochemical and morphological alteration in the cells induced by the disease. That is called mechanism of development. That is called the morphologic changes. Just as I have explained you, cirrhosis of liver. What happens in cirrhosis? Any idea what happens in cirrhosis? What is the basic thing? Applied anatomy. Tissue damage? I know tissue damage. That's why you're studying pathology. So what happens? Fibrosis, bridging fibrosis, formation of nodules. Why those things take place? That is the morphologic changes. Why a liver shrinks? In fatty liver, why a liver increases in size? Why? It's because of deposition of what? Fat. Then it progresses to a stage of cirrhosis. If the person do not cut down on his alcohol consumption, it will go into a stage of cirrhosis. What happens in cirrhosis? Why the liver shrinks in size? Yes, but what happens there? For example, there will be some hepatocytes which die and some hepatocytes which will survive. So there's basically a tug of war between the hepatocytes which survive and the hepatocytes which are dying, ultimately resulting in formation of nodules, then bridging fibrosis. All this you will study. I'm not getting into the details of that, but all these things you're going to study when you study about cirrhosis. And finally, the functional consequences of these changes. Functional consequences, find out the functional consequences of these changes, which is the clinical manifestation. Hepatic failure, portal hypertension, in case of say, cirrhosis of the liver, ascites, edema, right? Physiology. Is this point clear? Is this slide clear? Then only I'll proceed to the next slide. Clear? Sure. So core of pathology is formed of 4 things. That is the etiology, that is the cause of the disease. Number 2, excuse me, pathogenesis, that is the mechanism of development. Number 3, morphological changes, which means biochemical and structural alteration in cells and tissues. And finally, the clinical manifestation, functional consequences of these changes, ultimately how the patient presents clinically. So in practice, you won't get this sequence, but everything will be in a reverse sequence, right? এখানে যদি 1 2 3 4 করি cause number 1, number 2 mechanism of development, number 3 biochemical and morphological changes, number 3 clinical manifestations. In practice, গ্রাউন্ড রিয়েলিটিতে কি পাবে? উল্টোটা পাবে। Patient will present with the clinical manifestations. Right? এই জিনিসটা মাথায় রাখতে হবে। So this is something that you have to keep in mind. Okay? Clear? Okay, so I'm going to the next slide. How does a cell respond to stress? How does a cell respond to stress? I won't keep this class too long. Again, tomorrow morning I'll be taking a class. How does the cell respond to stress? Suppose consider a person. Consider a person going to the gym for the first time. Consider a person going to the gym for the first time. And say he wants to do an exercise of, which muscle is this? Tell me. Traps, trapezius. So what he has to do? This is shoulder. So what he has to do? Shrugs, right? So he takes weight for the first time, and the instructor tells him, because you're doing it for the first time, take it with a 5-kilo dumbbell. Take 2 dumbbells and do a shrug. Say after 2 days of doing it, what changes can happen? Your muscles, they are of a particular size. So when you start working on it, or you say working on your biceps, or you start working on your back, say latissimus dorsi, and you start doing all the pulls and all, what changes can happen? There will be increase in the size of the muscle fibers. And because of that, you'll get a little bit of pain. Right? So basically, this person has been subjected to a condition of stress. You are leading a normal life, then you start going to the gym, or forget gym, after many days, who plays cricket, you start bowling. Do this full hand bowling. See the pain that happens in the pectoralis region. Why? Same thing, because you have been exposed to a situation of stress. You were stressed out. Basically, that takes you, but you have not injured yourself. You are perfectly healthy. You have not gone to the hospital, right? So what is that condition called? Adaptation. When you are exposed to stress, you adapt yourself to that kind of condition. Clear? When you are exposed to stress, you adapt yourself to that kind of condition. You have come from home, you're not in a mood to study, but you have an exam coming up. You have to adapt yourself to that kind of situation. You used to study, say, 6 hours a day. Before exam, you're studying for 12 hours a day. So that extra 6 hours is because you were in a state of stress. And if you cope up with that, you have adapted yourself. Right? Now, take the same example of this guy going to the gym. Instead of the person picking up a 5-kilo dumbbell, picks up a 25-kilo, try to pick up a 25-kilo dumbbell. What can happen then? No, what can happen then? What can happen then? Why people in gyms, why the trainers in gyms say don't pick up too much of weights? The most dangerous is the back. I'm telling you, because I do gym, I'm telling you the most dangerous is the back. If you do a deadlift, have you heard of a deadlift, a condition of deadlift? You try to do a deadlift, I have never done it, and you pick up a 25-30 kilo, try to do it for the first time. The most important thing that can happen is injure your lower back, and if that happens, you may be crippled. If your luck is bad, you can be crippled for the rest of your life. It's dead. It can kill you, literally. Deadlift is so dangerous. If that happens, why that has happened to you? Say you've picked up a 25 for your shrugs and you totally rupture some of the muscle fibers. Here you are not exposed to stress, but you are exposed to literally an injurious stimuli. You're literally exposed to an injurious stimuli. So that is called a cell injury. That is called a cell injury. And sometimes stress can be so severe that it can also cause cell injury. So normal cell, it's in a stage of homeostasis. You put it in a state of stress. You put it in a state of stress where the body is able to adapt. So that is called adaptation. If this stress continues and your body fails to adapt, it can injure your cells. That is cell injury. And also, instead of stress, the body is exposed to an injurious stimuli. There can be many injurious stimuli, which I'm going to talk about tomorrow, or if there is time, I'll talk today, that can injure your cell. So either you adapt to the situation, or there is a cell injury. Now, if the cell injury is mild or transient, just remember it. Cell injury is mild or transient. These are just crude examples I'm taking. If the injury is mild or transient, that is called reversible cell injury. Means the injury reverts back to normal. The injury reverts back to normal. You see, not India, I won't take example of India, but if you see YouTube videos and say, for example, United States, Russia, say United States, their law and order is actually very good. And say 11, 12 years old guy, because they're allowed to have guns with them, sometimes they shoot. Or sometimes they cause petty crimes for which they're not sent to the jail, but they're sent to a juvenile court. So that is basically some kind of a reverse that can be equated to a reversible injury. Okay, the guy is young. The law and order, the law says that a person below this particular age will not be sent to the prison, but should be sent to a center where he or she can adapt and change himself, get back to normal life. That is equal to a reversible cell injury. If the injurious stimuli is removed, the cell reverts back to normal. So either the cell adapts or the cell goes into a state of injury. If the stress is not too much, the cells will adapt and finally get back to normal homeostasis, to its normal position. Clear? But if the injurious stimuli is severe and progressive, it keeps on persisting. Severe and progressive cell injury will take you to a state of irreversible injury. Irreversible injury, like, for example, say heart attack, myocardial infarction. Myocardial infarction doesn't happen all of a sudden. You know the various arteries which supply the heart, and then even if they are blocked, the person do not manifest, because there will be formation of what? Collaterals. Only when the collaterals are damaged or the collaterals are also blocked, that's when absolute cessation of blood flow to the myocardium causes a myocardial infarction. That is irreversible injury. So if the injury is persistent, if the injury is severe and it keeps on progressing, the cell goes into a state of irreversible injury. The cell goes into a stage of irreversible injury. Irreversible injury is manifested, means basically irreversible injury is equivalent to what? Cell death. Irreversible injury is equivalent to what? Cell death. Means irreversible injury means the cell is dead. End of the story. Cell has been killed. That is manifested by two ways. One is necrosis. You know what is necrosis? Poche jawa basically. And khati banglaয় poche jawa, necrosis. And the other one is apoptosis. Have you heard of these two terms? Necrosis and apoptosis. What is apoptosis then? Programmed cell death or suicidal cell death. The cells destined to die, they know that they are dying, so they activate their own enzymatic machineries which degrades them basically. Okay, so this is a cellular response to stress. You should know, because why I'm stressing so much on this, because if you have a concept, Philadelphia chromosome CML পাবে তুমি T922. Okay, ঠিক আছে. So has that anything to do with this one? Okay, so is this slide clear? There's a normal cell, or you think of yourself, you are exposed to a kind of stress, you either adapt or you go into some kind of, say, a condition where you are not being able to adapt. Say you fall ill. A person falls ill. Okay. If that injurious stimuli is not progressive, it is not severe, it's mitigated, the person gets back to health. The cell gets back to health. But if the injury is severe and progressive, If the injury is severe and progressive, the cell goes into a stage of irreversible injury, a point of no return. A point of no return. And that point of no return is basically what? Death of the cell. That is cell dead. The cell has died. So that is manifested, the cell death is manifested by two forms. There are two ways a dead cell can manifest. One is the two types of death basically. One is necrosis, the other one is apoptosis. That's how it is. So now, are these slides clear? Are these slides clear? So before ending, I'll be talking a little on the causes of cell injury. But tell me, have you understood these slides? Sure. Thank you. So what are the causes now? Look into the pictures. Look into the pictures and tell me what can be the first cause. Hypoxia. Very good. Oxygen deprivation. How do you know that is oxygen deprivation? Huh? So what happens in a tree? Photosynthesis, right? Okay, very good, very good. So what can be the causes of hypoxia? Yes, that is the first one is hypoxia. So what can be the cause of hypoxia? What is the difference between hypoxia and anoxia? What is the difference? Yes, what is hypoxia? Anyone? What is lack of oxygen? You must be very clear what is hypoxia and what is anoxia. Anoxia means total absence of oxygen. Hypoxia means deficiency of oxygen. Hypoxia means deficiency of oxygen. There's a difference. But hypoxia can, well, and forget anoxia. Actually, I've studied in some biology books that no living beings can survive in a stage of anoxia. But yeah, in hypoxia, you can survive for a while. Then it goes into a stage of irreversibility, a point of no return, the cells. Okay, so hypoxia. So what can be the cause of hypoxia? Like in decreased oxygenation of blood, decreased oxygen carrying capacity of blood. What are the causes of decreased oxygen carrying capacity of blood? Anemia. Then decreased oxygenation of blood, decreased oxygen carrying capacity of blood, say blood loss, etc., etc. So these are the various causes of hypoxia. Simple causes. You know what they can be. What is the next one? So person is face is covered in bandage. Yeah. Physical. Yeah. So what is it? Physical agents, physical damage, physical injury. What can be the causes of physical injury? Road traffic. So many. Road traffic accidents, any kind of trauma, radiation injury, burns, colds. Okay, like for example, one of my friends means he's even younger to you or maybe of your age. A few days back he went to, for this student exchange program, he went to Moscow. And he came back to Delhi, and from Delhi he called me up, showed me a picture. He has frostbite. That's also a physical injury because of extreme cold. So it can be burns, it can be cold, it can be radiation injury, it can be a trauma, it can be so many things. So that is the physical. They will not ask you this question. Don't worry, this question will not be asked. I have never seen someone asking such an easy question in examination. You're lucky enough to get this question. You won't. I'm pretty sure you won't. But at least you should know the causes. Physical. Number 3. To the left. Huh? What? Yes. What's your name? Bolo. Microorganisms. Yes, very good. So what are the microorganisms? Bacteria, viruses, fungi, parasites, protozoa, etc. etc. So many are there. Beyond my scope to explain. Beyond anyone's scope to explain everything. No. Excuse me. You know why I'm putting these pictures? It becomes easier for you to understand. Just putting theory you can study from the book. This becomes easy. Number 4, RX means treatment. Chemical agents and drugs. Chemical agents and drugs. Oxygen at a high concentration can kill you. There's something called oxygen toxicity. Have you heard of something called the free radicals? Free radicals. I'll be explaining it tomorrow. Free radicals. Okay. Okay. This one, number 5, this girl looks very happy and all, but there's nothing to be very happy about it. When I'm explaining it in case of cell injury, what do you think it can be? What do you think it can be? Yes, let me see. Baki gulo to easy chilo. Hey, this one, the left, this one. Lifestyle changes eita asche, eita ki? Quiz. Come on, tell me. Somebody tell me. Huh? Aging. Mone hocche aging. একটা পার্সন খুব হঠাৎ দেখবে একবারে হাসছে এই করছে yes somebody said something I heard the correct thing huh mental disability is correct yes you said something somebody said something huh mental yes mental condition disbalanced mental condition স্যার এটা কি হতে পারে হ্যাঁ কি বিপিডি মানে bipolar disorder অনেক হাই লেভেলে চলে গেল কম লেভেলে yes correct but it's a good guess you're trying see you're using your brain I'll let you use your brain so what can it be yeah you have studied it পরীক্ষার কোয়েশ্চেন আসছে পার্কিনসন্স তো এরকম প্রেজেন্ট করে না তোমরা পড়েছো এই জিনিসটা you have studied it come on now tell me পরীক্ষায় কোশ্চেন আসে আচ্ছা এটা অ্যানাটমিতে কোশ্চেন এসেছিল এটা this is just an example এরকম অনেক আরো পিকচার দেওয়া যেতে পারে many prototypic pictures can be put but I have just put one picture for you to easily understand yes huh hallucination Try guess. Genetic derangements. Can it be Down syndrome? Edwards, Patau's. So this is basically Klinefelter's to বেশি একটা বাচ্চাকে এখানে Klinefelter's আসছি না. Let's think of Down syndrome. Or for example, let's think of cretinism. Can it be a genetic derangement? That's all. That's what I mean, genetic derangement. এখন আমি বললাম কি genetic derangement অনেক কিছু হতে পারে. So many genetic derangements can be put, but I have just put this one. An abnormal look, not abnormal, actually this may look very jovial, but আমি একটা prototypic example দিচ্ছি. আমি যদি লিখে দিই genetic derangements, you will not use your brain. This one, what is it? They are very similar, but this is what? Obesity. Means what? So obesity comes under what? Lifestyle modifications. Yes, lifestyle is a good answer, but I'm looking for something better. It's a good answer, but I need better. Junk food is not a very good answer, but correct. Lifestyle modification is better than a junk food. That answer is better, but I'm looking for something probably the correct explanation. Obesity to boleche. So obesity and junk food and lifestyle modifications, they're all interrelated. Out of this, junk food lifestyle modification is the best, but what is it called? Okay, you say obesity, you say junk food. There are people who don't even eat food. Some models circle binge eating. What they do is they eat and they put finger in their mouth and puke everything out, so they don't get nutrition. So what is it called? Now I have given you the answer. They all come under nutritional imbalance. So nutritional imbalance. Trust me, I'm telling you, এই যে biryani, do you think biryani is good or bad? Biryani, if you leave the biryani তে কি করে maximum দোকানে ডালডা দেয়, which is bad. But if you make at home, make it with pure rice, put solid chicken or solid animal protein, eat with salad, very good for health. Only carbohydrate একটু বেশি যাবে. That is the only thing which you can cut down on. And finally this one, what is it? We will kill you. This is an immunologic reaction. It will be tough for you, but this is an immunologic reaction. So what are the causes of cell injury? Now you tell me, what are the causes of cell injury? One is hypoxia, then physical trauma, physical agents like trauma, cold, extremes of temperature like excessive heat, excessive cold, burns, whatever it may be. Then physical agents. What are those agents? Physical agents is gone. Then what is the third one? Microbiological agents. Physical agents are gone. Then comes the microbiological agents. That is number 3. Then you get drugs and chemicals. So many things. Oxygen, arsenic, mercury chloride. So many things. Everything. একটা লাইন পড়বে তোমরা নিওপ্লাজিয়াতে, whatever we do for fun, pleasure, lifestyle, for daily requirements ultimately turns out to be carcinogenic. এই লাইনটা পড়বে তোমরা, রবিনসন লিখেছে। Okay, then comes number 4. Number 4 is a genetic derangement, then nutritional imbalances, and finally immunologic reaction. So this is what I mean. This is what I mean. Oxygen deprivation, various physical agents. আমি যদি শুধু এইটুকু দিতাম, you wouldn't have used your brain to analyze what I am teaching. So let it be an interactive session. Let it be an interactive session so that it becomes easier for you and easier for me to explain. Excuse me, and easier for you to understand. Very simple. So I think it's 10:50 and today wasn't a scheduled class, so I stop here and tomorrow I'll continue with the